An amazing and wonderful round of applause for Cannabis. Woo! Thank you, Cannabis. We love cannabis. It's such an amazing plant, but do we love the endocannabinoid system? And are we as excited about the endocannabinoid system as we are excited about this plant? And we should be, because we each have this endocannabinoid system, and it truly was the mic drop moment in my first year as a cannabis nurse working with patients. So my name is Sandra Guynes. I am a cannabis nurse, and today I'm talking about cannabis nursing boots on the ground. And my desire is to teach patients they can control their health, and that is power. They can navigate medications and side effects, and they are the powerful ones, not us. Even with patients with acute care needs, my focus was wellness. We look at the patient's cannabis journey from 4 areas of transition. The 4 key areas are education, empowerment, engagement, and evolution. So that's what I'll be talking about today, and what I've seen as patients transition through each of these steps and become empowered on their cannabis journey. In this first stage, our primary role as cannabis nurses, we're participating in education. They're learning about the endocannabinoid system, or the ECS as we call it, for the very first time. And the endocannabinoid system, which we now know is a master communicating system and regulator for our entire body. So when you're teaching patients that they have this system that they never heard of before, it's like, what? And this is where education and empowerment really start to happen. They're learning not only about this system, but they may need to understand the political, racial, and systemic issues of why cannabis prohibition has existed, and also the implications that may arise with choosing cannabis as medicine. In the education phase, we're also assessing the whole person for any physical, mental, and emotional issues that may be a result of the ECS imbalance. Like, what is going on in your system, and how can balancing and resetting your endocannabinoid system through plant medicine or other modalities help bring you balance and wellness? Their beliefs and stigmas about cannabis as medicine also have to be worked through. And then the information they need to feel more confident and embarking on this journey needs to be absorbed. They need to be confident that this is the right path for them, and need to understand why cannabis actually works within their body. Now that we've provided the education and planted the seed, this is where our clients achieve a comfort level of knowledge, and we begin to enter the empowerment stage. So in the education stage, I feel it's important, especially for nurses in this industry. We get very excited, but we cannot force someone to hear a message they're not ready to receive. But we must never underestimate the power of planting a seed. So now that we've planted this seed of what the endocannabinoid system is, and we've given them this incredible, unbelievably powerful tool of knowing that their body has this unique system that is, helping regulate their whole body, it provides them a tangible reason of why cannabis works in our body. And it also gives them the resources to understand that cannabis is medicine. And that's really where we start to see the biggest impact in our education. And with that information and understanding, now the clients are able to empower themselves in how to feed and nourish their endocannabinoid system. Specifically, some of the ways that we discuss in our practice for feeding and nourishing our ECS is through complementary practices such as meditation, massage, acupuncture, chiropractic, nutrition, and supplementation with vitamins, flavonoids, terpene-rich foods, and also at times combining these methods with traditional pharmaceutical medications that may be complementary with cannabis. In the empowerment stage, clients may be ready to try medical cannabis for acute conditions or chronic conditions, and they may also look for hemp-derived products. Each client is going to be different, and their starting point is going to be unique to them. In this stage, as a cannabis nurse, the most important thing that we can do is explain the differences between the products that are available and how they can affect the client, and also the implications, such as drug testing, that it could be psychoactive, safety issues, things of that nature. So this is the part of the empowerment stage where it really matters that we've given them all the information they have so they can go forth and make the best decisions on their cannabis journey. So we get into the engagement stage, which is actually the longest stage, I believe. There are not really mastering this cannabis as medicine yet, but they are in the trial and error stage. They're comfortable with understanding what products exist, where they can source good cannabis from, what's safe, and they feel more comfortable with managing their dosages at home. So when they're engaged, they're able to increase and decrease their dosage as needed based on desired effects. This is the opportunity for the client to review their experiences and just have a general awareness, because this is where awareness really happens, of how the cannabis is making them feel. And I would say engagement is more of the hands-free stage for the nurse. We're really trying to let the client trial and error things. Because we know the safety profile of cannabis, then we know that this is okay. Patients need to understand what they're feeling. If they're seeking relief, how long they're feeling that relief after consuming cannabis. They're also, as I said, in the trial and error phase, they're identifying what methods work for them. Not only what methods, but what cultivars, what strains benefit them best and help them manage their particular condition. This is a frustrating stage. This is the stage that's also the most rewarding. It's frustrating for the clients because they have to try different things and kind of figure out what's working for them and what's not working. In this phase, we try to follow up with our clients to ensure they're not, falling off their cannabis journey, and we can provide support and encouragement through this process, but we also need to allow the patient to still be in control of navigating their care. So we're going to talk about evolution next, the evolution stage where the client evolves on their cannabis journey, as noted by the word evolution. This is someone who's willing to explore more things. Maybe they're going to the dispensary on their own and trying different cultivars and strains. And what I say in this stage, or what we call in this stage, is that the client is discovering more cannabis journey pathways. So a different pathway for them on this journey might be the client uses cannabis for sleep, but now they're noticing that certain strains will make them or help them with sexual arousal or physical motivation to exercise. In this stage, clients are more open to trying cannabis for other experiences. They feel more confident. They're not all, but many in this evolution stage go from becoming, cannabis naive to cannabis confident, and then also even going forward and becoming cannabis advocates and sharing their wisdom forward. However, they may return to the empowerment or engagement stages based on other conditions emerging or seeing benefits of cannabis for other health issues and needing more guidance. So usually these are brief consults that last maybe 15, 20 minutes. And these clients that are in the evolution stage have now moved on to being more confident in cannabis. Again, these are all the stages that I believe a cannabis patient will go through on their journey from education to evolution. The one thing that I wanted to leave you with is the greatest discovery of all time is that a person can change his future by merely changing his attitude. And I really believe that through education and empowerment and helping our patients navigate this cannabis journey to evolution, that we as nurses can help change not only healthcare, but individual lives through sharing not only our knowledge, but definitely our passion and a process that really helps patients go from not understanding cannabis to becoming empowered and taking their cannabis journey into their own hands.